Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Stephen Marshall. He is a medical writer. His Kevin MD article is titled Understanding the End of the COVID Public Health Emergency. Stephen, welcome to the show.
Thank you, Kevin. I'm glad to be here.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Okay. I started as a volunteer fireman back in the 80s and proceeded to nursing school right after high school, worked in critical care, emergency rooms, did flight nursing, and also did some ground transport, was bedside primarily at the critical care level, and went into leadership about 10 years ago. Became involved in the COVID response for the local organization, and we wound up starting multiple mass vaccine sites, mass testing sites, and then ultimately we started a large infusion center when the monoclonal antibodies were approved. And currently, I help oversee the infectious disease clinics for our organization and started a medical writing company a few months ago, just as kind of something to do on the side and hopefully a bridge to retirement for me.
All right. So, you have been through many hats clinically, leadership, and especially during the pandemic. Just from your perspective, what are some of the biggest changes post pandemic that you saw in our healthcare system?
A lot of mobile medicine, telemedicine. We have a lot of increased percentages of the amount of patients that do virtual
Yeah.
appointments. There's less traffic in the offices now. We've seen much less flu and other infections during the time period where we were requiring masks, which has been a mandate that was recently stopped. But as far as the flu seasons, they've been much less prominent. I think it's important to remember that we do still have COVID, and I think that's we want to maintain that awareness, and that's something that's kind of opened our eyes to infectious disease for a lot of people that hadn't really had much exposure to it.
So, I'm interested in diving more as we transition from that pandemic phase to the endemic phase. You wrote a little bit about that in your Kevin MD article, Understanding the End of the COVID Public Health Emergency. So, tell us, how did your article come together?
I wanted to share with the public what changes were going to come about when the public health emergency ended. We've been in an unprecedented time where we were in a pandemic state for over 3 years,
Yeah.
and to the point that it became our norm. And I wanted to make sure that even though we're saying that the public health emergency is ending, that we're still very much in the throes of the COVID virus, and it's still mutating, and we still have instances of it. Fortunately, the death rates aren't near as high as they were just a couple of short years ago, but we still do have issues with it. And I wanted to share that we still have the available treatments, and we still need to take some precautions when necessary, even though it's not mandated where we go.
So, when it says that the public health emergency has ended, what exactly does that mean?
When the COVID crisis began in 2020, the government put forth the public health emergency to put into place a lot of different regulations and alleviated some regulations as well. So it actually alleviated some of the restrictions on doing telehealth visits,
Hmm.
and which has continued on through the post-pandemic state. And then also we had mandatory, at one point we had mandatory lockdowns, and we had mandatory masks mandates, and the encouragement of the vaccine, and also the very quick distribution and approval of the vaccine under the emergency use authorizations, as well as the monoclonal antibody treatments. And even though we're past the emergency state, we still do have, of course, the vaccines are available. They're working on developing a monoclonal for the current variants, but we currently don't have one that's approved.
And you said that COVID is still, of course, present. So, give us an idea of some context in terms of the lingering effects of COVID that you're seeing.
We have a lot of patients that have what they call long haul COVID,
Hmm.
and they experience continued respiratory symptoms from the disease process. And this tends to affect a younger population, which is not typical for a lot of the continuous diseases, chronic diseases that we see, and to just increase in that awareness.
So, in terms of some of the things that will stay the same and some of the things that will be changing, tell me some of those changes that would persist past COVID. What are some of those?
The approval for the telehealth, the regulations for telehealth, that will be staying the same. The availability of the vaccine and other testing kits through the government, those will continue on. The emergency use authorizations for the medications that are still approved, some of the oral antiviral agents, those will continue to be available as well.
Now, when you say about the telehealth regulations that will stay the same, go into more detail about that.
The regulations prior to COVID, there was a lot of restrictions, and it made it difficult for providers and clinicians to conduct a routine health visit over the telehealth platforms. And with extending this, it allows more patients to have access where they would have otherwise had challenges with transportation and such. So visits that could primarily be done through a telehealth visit before that may not have been covered by Medicare, Medicaid, or private insurance will continue to be covered by these after the public health emergency ended on the 11th.
Now, tell us some of the things that will be changing because of the end of the emergency.
Some of the things that will be changing is the requirements for private insurers and Medicare and Medicaid to pay for COVID treatments and testing.
Mm-hmm.
Those were coming to an end, and requiring testing for various institutions or organizations and entry into the country, those will be ending. And also, we ran into a large PPE shortage during the COVID pandemic, and that resulted in manufacturers of PPE having to report their equipment levels or their stock levels and on a continuous basis, and they will no longer be required to report that information.
Now, of course, we've learned a tremendous amount during this pandemic, for good and bad. What would you say are the biggest lessons that you have learned from the pandemic?
Some of the biggest lessons that I've learned is just being able to adapt quickly to a growing situation. It was something that was unprecedented for us, and we were putting together testing sites and vaccine sites on short notice. We completely renovated our mobile program. So we had mobile sites that went out to churches and fire departments and schools. And we were at one point at the peak, we were doing thousands of tests a day at 5 to 6 different locations across multiple counties. And we had to come up with a lot of our own ideas and ways to do things because this had never been done before.
Give us an example of that. What's a story where you just had to come up with something on the fly that wasn't, say, in some type of guidebook, rule book, or textbook?
With the mass vaccine sites or the mass testing sites, so we put together a tent set up with a drive-through for the cars, and we had an instance we were printing off the requisitions, and then somebody would pack the requisitions into the bag. And on one particular instance, our printers went down, and so we ran out of toner, and so we were unable to print anything. So we had to switch over quickly to a manual process to get all the information in to move the testing patients through. And that particular site, I think we did a little over 500 tests in 4 hours. And for the majority of that time, we were unable to print electronically, so we had to go back to the old paper and pen.
I think another lasting effect, of course, is the clinician and nurse shortage. Right, there's a lot of attrition due to burnout.
Yes.
That stems directly from the pandemic. So tell me, what are you seeing in your healthcare circles?
We have a lot of travel nurses throughout the area. There's been, during the pandemic, because of some of the assignments the nurses went to, the pay increased exponentially for some of those travel jobs, and we had a lot of our bedside staff that went to travel to make make the money and then make a difference in some of the areas that were hit worse than we were with the pandemic. And that has created a lot of nurses that have early retirement. We've had a lot of nurses that have retired through the pandemic just from the stresses, like you say, burnout, and they may have retired early and gone on to another career or another journey. And so we don't have the stability in our workforce. We see a lot of new nurses coming in, and nurses are moving up the career ladder into leadership positions much younger than they used to, because the pool of nurses that have been in a position for more than, say, 5-10 years is very shallow right now.
And as it relates to that attrition and new nurses coming into the workforce, what do you see as a path forward over the next year or so?
Think we'll continue where we are. There's a lot of the nurses that are coming in to the profession have their sights set on either becoming nurse practitioners or CRNAs, and there's not a lot of drive for nurses to stay at the bedside. So I think we may continue to see growth in the specialties with the nurse practitioners. I think that's expected to be something that will actually grow over the next few years. But I think the bedside nursing staff is going to remain at a critical state.
So, what are some solutions to shore up those bedside nurse numbers?
Sign-on bonuses have been beneficial in the area. Retention bonuses, contracts. So with the pay rates being significantly higher with the travel nursing, several organizations have had to adjust their pay scale for nurses and raise the starting pay for RNs. And unfortunately, we've gotten to where, the pay is a major driving factor in getting nurses in and keeping nurses.
We're talking to Stephen Marshall. He's a medical writer. His KevinMD article is titled Understanding the End of the COVID Public Health Emergency. Stephen, tell us some of your take-home messages that you want to leave with the KevinMD audience.
All right. Thank you, Kevin. I would like to say that we are still in the midst of the endemic with COVID, and it's something that shouldn't be taken lightly. Fortunately, we're in a much better place with treatment options, and with the loss of human life has decreased tremendously, but we're still very much in the throes of this outbreak, and it's been something that us clinicians and providers haven't seen ever in our careers. So I think it's important to stay vigilant with hand hygiene and make sure that you're taking care of yourself. And if you are sick, to self isolate and make sure that you're getting the proper treatment when needed.
Stephen, thank you so much for sharing your time and insight. Thanks again for being on the show.
All right. Thank you, Kevin. I appreciate it.